Imagine a bank vault left wide open for anyone to walk into, but the money inside was supposed to care for children and the elderly.
Right. I mean, it sounds like the setup for a ridiculous movie heist, doesn't it?
Oh, totally. You'd think there'd be guards or, at least a heavy locked door.
Yeah, but when you look at the stack of federal indictments and reports we're digging into today out of Minnesota, you realize that an old-school bank heist would have honestly been harder to pull off.
Federal agents just charged 15 people in a massive $90 million Medicaid fraud scheme.
90 million. It's hard to even wrap your head around.
It really is. And we're talking about fraudsters who allegedly stole money meant for autism therapy, childcare, and disabled housing.
Exactly.
And they didn't just quietly pocket those funds. They went out and spent them on luxury cars, Rolex watches, and overseas real estate.
Yeah, and we are looking at a huge stack of sources today. Local news, national reports, federal indictments, and statements straight from the Department of Justice.
So our mission today is to figure out exactly how millions of dollars slipped right through the safety net.
Right. We really want to explore the daily mechanics of this staggering fraud and understand what happens when federal enforcers finally step in to shut the whole thing down.
And you, listening right now, you should care about this because, well, this is your taxpayer money.
Exactly.
These schemes exploit programs designed to help the most vulnerable people in our communities. Okay, let's unpack this.
Let's do it.
We need to start with the largest single piece of the fraud to see how they actually operated day to day. We are talking about a staggering $46.6 million scheme.
Yeah, that number is just massive. And to understand how they pulled it off, the sources focus on two people, Shamso Ahmed Hassan and Hanan Mursal Yusuf.
Okay.
They ran the Smart Therapy Center and the Star Autism Center. They billed Medicaid for $46.6 million, and they actually walked away with over $21 million.
Just walked away, like, into their own bank accounts.
Yep, free and clear, before anyone stopped them.
But how? How do you bill the government for $46 million without a massive red light flashing in some auditor's office? I mean, they didn't just inflate a couple of bills, right?
No, this wasn't just padding the margins. It was a highly organized kickback economy. To bill Medicaid, you need real patients. You need real Medicaid ID numbers.
Right.
So they actively paid parents illegal kickbacks, cash bribes, ranging from $300 to $1,500 a month.
Wow.
Yeah, just to enroll their children in these clinics.
So they were basically renting the kids' identities to get access to the billing codes.
Exactly. And the most shocking part, they did it regardless of whether the kids actually had autism.
You're kidding.
Nope. They bribed parents to outright lie and say their kids were showing symptoms just to create a fake medical file.
That is wild. And the statistics in the reports really highlight the absolute absurdity of this. Like, in one case, a clinic billed the state for 3,000 hours of training for a single family.
Over just an 18-month span.
Right. That's over 5 hours of therapy every single day, weekends and holidays included, for a year and a half.
It's just crazy math.
And the family received exactly 0 hours of actual training. That is like a gym charging you for 8 hours of brutal personal training every single day while you literally just sit on your couch eating chips.
That is a perfect way to picture it. The gym just keeps sending the automated bills, and the government just blindly cashes the checks.
Man.
And imagine if that gym also billed you for a ghost trainer who didn't even work there, because they fabricated the therapist too.
Wait, how do you fabricate a therapist? Don't they need, like, medical licenses?
You would think so.
Oh.
But they submitted claims for therapists who didn't work there at all. They just took people who had done a basic training course, stole their names and credentials, and slapped them onto the billing spreadsheets.
Unbelievable.
And once the state paid out, they laundered the money into real estate in Kenya.
But this brings us back to the core question. How does a state agency not notice ghost therapists and 3,000 hours of imaginary training?
Well, what's fascinating here is how the rapid growth of these programs created massive blind spots. The Medicaid spending on autism therapy in Minnesota exploded. It went from $38 million in 2020 to $442 million in 2025.
Wait, 38 million to over 400 million. That's more than a tenfold increase in 5 years?
Right. So the state's auditing system was just totally overwhelmed. They were buried in spreadsheets instead of actually walking into these clinics to see if real humans were inside.
Here's where it gets really interesting, but also incredibly tragic.
Yeah.
Because if it were just fake invoices and ghost clinics, that's one thing, a victimless spreadsheet crime. But this fraud had a devastating human reality.
It really did.
This didn't just cost taxpayers money, it cost vulnerable people their safety, and in one case, a life. Let's look at the housing side of
Right,
this.
the Housing Stabilization Services, or HSS, and the Integrated Community Supports Programs. The whole point of these programs was to help seniors and disabled folks find stable housing. But just like the autism program, the costs skyrocketed. HSS jumped from an expected $2.6 million to over $104 million.
And what was that money actually paying for? Take 22-year-old Ahmed Othman Kadar.
Yeah, this case is awful.
He ran Ultimate Home Health. He just rented an 11-unit apartment building, threw Medicaid recipients in there, and billed the state $1.4 million.
And the conditions were a nightmare. Tenants complained they were left without electricity and heat in the dead of the Minnesota winter.
Freezing in the dark while a 22-year-old is raking in over $1 million. And it gets worse. There was an elderly man identified as RC.
Yeah, RC was supposed to get 24-hour care.
Mm.
Kadar billed Medicaid heavily for him, but RC died completely neglected. And court records say Kadar actually submitted a brand new bill to Medicaid the very day after the man was found dead.
I mean, how does a 22-year-old run a healthcare facility with no electricity, and no one from the state ever checks on the actual human beings living there?
What's fascinating here is that the system was built this way on purpose. The programs had purposely low barriers to entry.
What does that mean?
It means the state made it super easy to become a provider because they wanted to prioritize rapid access. They didn't want long waiting lists.
So they just skipped the background checks.
Pretty much. They removed the security hurdles, which just rolled out the red carpet for bad actors.
And the contrast is sickening. People like RC died in freezing apartments, while suspects like Charles Healy and Catherine Lurson Guthmiller billed $22.7 million.
Yeah, they literally forced disabled tenants to use their fake services if they wanted cheap rent.
And what did they buy with your taxpayer money? An Aston Martin, 3 Porsches, 3 Teslas, and 5 Rolex watches.
The extreme greed is just hard to stomach.
Because the state's oversight failed so drastically, we have to talk about the massive federal intervention. The feds finally had to step in to stop the bleeding.
Right. The FBI, Homeland Security, and a brand new DOJ National Fraud Enforcement Division all swooped in.
It was a massive response.
And if we connect this to the bigger picture, it highlights a crazy new trend called fraud tourism.
Fraud tourism.
Yeah. The state's rules were so loose, suspects were literally traveling from Pennsylvania all the way to Minnesota just to set up fake housing companies and steal millions.
Wow. They knew the vault was wide open.
Exactly. So Dr. Mehmet Oz, the head of Medicare and Medicaid services, had to step in and officially freeze $350 million in state funds. Child care funds got paused, too.
And the consequences are getting severe. Amy Bach, the mastermind of a related $250 million COVID meals fraud scheme, was just sentenced to nearly 42 years in federal prison.
They're definitely sending a message that the gold rush is over.
So, what does this all mean for you? When local oversight completely fails, it stops being a local crime story. It becomes a national political weapon.
Oh, absolutely.
Now, we need to be clear. We are not taking sides here. We are strictly reporting how the original source material describes this political fallout.
Right, just looking at the facts on the ground.
Exactly. And that sources show high-level federal involvement instantly. Vice President J.D. Vance is leading the White House task force to eliminate fraud.
And Health Secretary RFK Jr. actually traveled directly to Minneapolis to announce these charges.
Right. And President Trump, along with conservative commentators, placed a huge national spotlight on the crisis. They heavily criticized the massive waste of taxpayer dollars.
Yeah, and they pointed out that many of the indicted suspects are of Somali ancestry. President Trump actually called the state a hub of fraudulent money laundering on the national stage.
Which created a massive political earthquake locally. Minnesota Governor Tim Walz defended his administration, but with all this pressure, he actually dropped his bid for a third term.
And now, the state legislature is scrambling to create a brand new Office of Inspector General to fight future fraud.
Trying to buy a lock for the vault after the money is already gone.
Pretty much.
Let's bring this all together. Fraudsters saw an open vault and walked right in. They stole $90 million using fake patients and illegal kickbacks.
They bought luxury cars while real people suffered in freezing apartments.
And it ultimately forced the federal government to freeze hundreds of millions in funding and make sweeping arrests just to clean up the mess.
Which leaves us with a really tough question. If low barriers to entry were the exact feature that allowed criminals to steal millions, How can society design safety nets that quickly help people in genuine need without leaving the door wide open for sophisticated fraudsters?
Where is the line between trusting citizens and inviting theft? Because clearly, if you leave the vault open, someone is going to walk in.